Are you leveraging AI to its maximum potential to make your work and life easier? Find out how. Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. We have a super interesting guest today. And is it really him? We've got Dr. Harvey Castro, who is an ER physician known as Dr. GPT. He's got over 20 years of experience in emergency medicine, authored numerous books, 20 plus books, including the unofficial guide to AI mastery. He also serves as an advisor for the Singapore Ministry of Health and Texas Medical Association, focusing on AI-driven innovations in personalized medicine. He's created on top of all that, he's created upwards of 40 apps. So he's going to clarify, for us and help us to use AI to our advantage. Dr. Castro, thanks very much for being on the podcast.
Thanks for having me. Great talking to another doc.
So let's step out of healthcare for a second. I know we're two doctors talking, but I would imagine that you're using AI in all sorts of ways that just make your life easier. And we were getting to that before the show. So as an AI early adopter, what are some of the ways that you're using it to make your life outside of healthcare easier?
I'm having tons of fun. I'll start with saying that I was just talking to you right before we started. I created my own digital twin and I uploaded all the interviews I've ever had, all my PowerPoints, all my books, anything that I've written, and it's any blog office on there. And so what makes my life easy is by having that information, it's on a secure server, only I have access to, no one else has access to it, not even ChatGPT or anybody like that. And I'm able to leverage my information. For example, I'm writing a book right now, and one of those sections is going to be ethics. And so literally I can go back and look at all the stuff I've ever written and have a conversation with myself to get it. Other things that are just kind of different than everybody else. When I'm on a drive, there's some websites that I'm able to have a conversation and have a podcast. And so example, I want to learn about, let's just say AI in healthcare. So I'll give you the URL and you can have a conversation, say, hey, what's going on in the news today? And it says, well, the stock market today was X, Y, and Z. And I can interrupt it and say, wait, I want to know about healthcare and AI. And then it's a whole podcast going back and forth. And so that's something different that I know most people don't.
What is that URL? Just because some people go to the show notes and some people don't, but if we can let them know.
It's called Chatter AI, ChatterAI, and the company that made it, it's Hume AI. And it's pretty fun. Exactly. You can just drive and have a conversation with your podcast and learn about anything you want. And it literally goes on Google per se, does the search, and then you have a conversation. And so that's kind of neat. Other things that I do for myself, I'll create AI agents. And it's just think of it a program that goes on the web and extracts anything I want. So if I'm doing a big talk, for example, next month I'll be speaking in South Africa on AI and medicine. And so I have a bot right now that will go through, look at the web, look at any information, and then create 10, 20 pages, whatever I want. And then it gives it to me with all that information specific to AI and pharmacy. Then I can take that and make my PowerPoint.
So you're using AI to do presentations on AI. Very meta.
Yeah.
Let's go back to the digital twin because it sounds like you can upload stuff that isn't necessarily yours, right?
Mm-hmm.
Like just stuff that interests you. Kind of the same idea. What you're doing is you're uploading information to a drive, and then the AI does what for that? What are you asking it to do?
So here's a real example. There's tons of information out there, and I'm sure there's a bunch of YouTubes that you want to watch. And so let's take a specific example, a TED Talk. And so what I'll do is I'll take that TED Talk and I'll extract the transcript. YouTube already gives you the transcript. I feed it into AI so that I can have a conversation with that data. So I may say, just give me the key points of this TED Talk. And then it literally will give me what I need to know. And then if I really want to listen to it, I can. Or if I want to take that concept and apply it into another vertical, then I have AI do that for me. Case in point, yesterday I did a post on leadership and how it relates to Darth Vader. And I took, one of my friends was like, oh my God, there's this book on Darth Vader and leadership. I'm like, really? And so she gave it to me. And then I was able to take the content of that book, put it into AI, extrapolate, and then I got like the 10 top leadership skills for as from using Darth Vader. It's taking one data, plug it into our mindset, our creativity, combining the two, and get another output. And that's what AI can do if you really think it through.
How
So,
can you trust the fidelity of it? Because I had one experience where I tried to see if I could get it to write blog posts for me. And I think it might have been a year ago. I did an interview with Dr. Aline Gregosian, and she had during her ER residency, she went into heart failure, ended up getting a heart transplant, right? And so I said, like, write me a blog post based on this article. And it was like, the theme was like, why you should trust your doctor and why she got pneumonia. She didn't get pneumonia. She happened to mention that she thought it was pneumonia once, and it just took that idea and it ran with it. And it got it completely wrong, right? So I just did probably what most people do. Like, this doesn't work. Trash.
well, yeah, let
So
me jump in by saying a couple of things. The technology is only getting better. So whatever you saw last year, I can almost guarantee you is probably 10 times better today than back then.
yeah,
Then think of it this way. Maybe you were talking to an equivalent of an elementary student, and now you're getting closer to talking to possibly a master's student. And probably by next year, you'll be talking to a PhD student. And so having a conversation with someone in grade school is only going to give you so much. But if you're able to speak to a PhD, you're going to get higher quality. And then to continue the analogy, it's all about how you speak to that PhD student. So
yeah.
depending how you speak to it, if you give them some good background, then they're going to give you better output. What I would do today with that interview is I would take that exact transcript and then put it into the newer models. And then my favorite phrase right now, has been for years now, is we need to keep a doctor in the loop or a human being in the loop. So yes, it's going to hallucinate. Yes, it's going to make mistakes, but that's where you come in and say, you know what? All of this is excellent, except for this one part. Let me tweak it. Let me change it.
You just said a word that I want you to extrapolate on it a little bit. It's going to hallucinate. What is an AI hallucination?
Great point. So think of it. I always give this analogy. If you have the smartest person you ever knew, but they're too proud to ever say they're wrong. And so it's like having a conversation again with that PhD student, but they're not humble enough to say, I have no idea. And the sad part is that PhD student doesn't know that they're wrong. And so when it hallucinates, think of it as you ask a question and it may be totally off, may not be correct. And as a human being, we need to know. That's why this technology is very dangerous when it comes to some patients, because they may not realize that that information is totally wrong, and
So
they're
maybe
taking it for face value.
confabulation.
Yeah, that's a better
Confabulation
word.
is probably a better word, right? Because that's what
Yeah,
patients with delirium or dementia might do. They'll make up an answer that kind of fits with what they think you're asking them. So I think
yeah.
an AI confabulation might be a better, maybe we should coin
I think so. We should trademark it and make some
that.
cash. No, but that's well said, and that's why us physicians have a hard time with that word hallucination, because it
Yeah.
doesn't really explain it.
No, it doesn't jive. Doesn't jive. So what are some other ways that you are embracing AI in your, like, is it making you coffee in the morning? Like, is it, what other kind of like mundane stuff are you offloading to AI?
This is kind of a project that I'm launching here this week. This will be interesting to you. I do a lot of talks and I want to make sure I'm getting better. So you and I are scientists and we're kind of OCD when it comes to something. I'm sure you hyper focus on things, and that's just part of being a doctor. And so what I've done is I created an AI that now can evaluate my speaking skills. So now it looks at how fast am I going? Am I going too fast, too slow? What are my facial expressions? Is my tone good? Is it not good for what I'm talking? And then it's even able to analyze my content and say, you know what, that content is not delivered correctly, or your storytelling was not on par where it should be. And then it gives you an 8-page report on exactly what you're doing, right and wrong. And so I'm going to apply that to healthcare. In about a month, I'll do something very similar for healthcare, for doctors.
I mean, it's interesting that you could use it for something that some might argue is like subjective rather than objective.
Well, I'll tell you exactly what I'm doing for malpractice cases and lack of empathy, or cases where we are not interacting with the patient. And so if I could take let's say a video of you with an actor, obviously that's already going to be fake. But if I were able to get maybe a patient to sign off and record the interaction, and obviously make sure it's HIPAA compliant and all that, then that interaction, the AI can take a note of things. Are you looking at the computer and the computer's on your left, but the patient's in front of you? Are you looking at your patient? Are you cutting your patient off? All those things can add up and make that interaction better. And the AI can walk you through and say, you know what, these are the things that you're doing wrong.
How is it being fed the information on what a better interaction looks like? That's what I mean by the subjectivity of it.
Yeah.
Like someone might blow through a patient visit super fast, but they're able to engage with them in certain ways and make them laugh and talk to them about themselves and their grandkids and really cover all the bases. But maybe the cadence of their speech is pretty fast, but appropriately so. And,
Yeah.
like you can do it well, but differently.
Yeah. No,
Um,
that's
you know what I
well
mean?
said. Yeah, no, I love what you're saying. I think it all depends on content.
Okay.
Excuse me, contents. And like, for example, I'm an ER doctor. I may be able to get away with speaking fast and going in and out because I have an emergency next door and patients understand.
Yeah.
As opposed to a family practice doctor, and let's just pretend that visit's 1 hour. They know it's an hour, 30 minutes, but they're not getting that. They're getting 5 minutes as if they were in the ER. If I prompt again, to the example of if I prompt the AI and saying, hey, we're in an ER setting and this is quote unquote standard versus
Mhm.
here's a family practice office, here's standard. But there's some core things that need to be done. For example, just talking to your patient, going through what you're going to order for them, explaining the disease process. I mean, there's a lot of things that you can create. What you say, well, that's kind of subjective. You're right, but there's a bell curve. And so
Yeah.
are you falling outside of that bell curve?
I think what you're saying is there's stuff that is harder to measure, like likability. Like how likable, how charismatic is your doctor? If you've got a super charismatic doctor and they're able to make you feel like you're the only person in the room, they've only been in there for 5 minutes. That's not really something, that's something that's, let's just say, yet, that AI can't measure and duplicate yet. However, the basics, eye contact, cadence of speech, and expression of empathy, like these are some things that we should be doing in each visit. You've got to check those boxes, and AI can do that. It can check those boxes. And it might be easier to hear that from an AI than from another physician, right?
Correct.
If you're like, know that you're being measured by something that's completely dispassionate, or is it going to be easier to hear that type of criticism?
I agree. And there's some algorithms that actually the same company that made that podcast called Hume AI
Yeah.
that I could take this video that we're having right now, upload it to them, and it can analyze over, I think it's 54 different emotions while we're speaking. So was I bored when I spoke? Were you upset? We would get a whole transcript of our emotions. And so imagine that extrapolated into the patient room. And
Yeah.
this is a large language model that's only been studied for emotions to the point where they're experimenting now with depression and your voice, and they're able to say, yeah, this person has depression. And now they're adding some other algorithms that they obviously have to get through the FDA approval to say, you know what, this voice sounds like early Parkinson's disease, or this person actually, their voice actually sounds like possible dementia.
You know what's going to happen? It's going to get built into Epic. And then
Hmm.
we're going to get a click box during the visit that says, express empathy now. Raise
Probably,
your eyebrows now. We're
probably.
just going to give us more prompts.
They probably will.
Uh,
And when we get to that point, we'll have our robot because according to Elon Musk, we'll have our robots by Q4 2025. And so
our
imagine
robots. What do you mean,
imagine,
our robots?
so right now, I foresee a future where robots will, in their eyes of the robots, will have ChatGPT 4 by then, probably 5 or 6. And what does that mean is the eyes of the robot can do a lot in the sense that it can analyze your tone, your demeanor. Let's use it in healthcare examples. The way you walk, you'd say, you know what, his left hip is something's going on. I could tell by the walk. When we're interviewing the patient, the AI is analyzing the patient and saying, you know what, his hemoglobin A1C average is this number. This is the sugar that I'm getting based on the algorithm through the eyes. The voice, their sugar is, they're probably pre-diabetic based on their
It's like a
voice.
screening test.
Yeah.
It'll function as a screening test. Yeah.
And so I do see a future, especially with our aging healthcare physicians and nurses as well, not being able to lift the patient. Here's a robot. It's going to help us lift the patient, walk the patient to the bathroom. All of that I foresee being here in the next 2 years. I say by 2026, we'll start hearing about cases like that at Mayo and Cleveland, that they'll have some of these robots.
Interesting. Interesting. So you had mentioned, right, the hallucinations or the AI confabulation, sometimes where it will tell you something that sounds convincing, but just be flat out wrong. So when you have patients that you're seeing and you're advising them on how to use AI in its current state to their advantage, what are you telling them? How are you teaching them how to embrace it?
My main thing with patients is as follows. Obviously, number one thing I tell them is don't put anything that you don't want out there as if you were going to put it on Facebook or any social media, because
Yeah.
you're literally training the model or you're putting it out there unless you're okay with it. Second, I'm explaining hard how hallucinations work, and I'm telling them they need to keep a human in the loop and they have to make sure it's the right human. So if they're specifically using healthcare and they're specifically, let's just pretend they're using something in dermatology, then they should either talk to their family practice doctor to verify that information or their PCP. Just because I'm so worried from a patient's point of view that even if it hallucinates 1% of the time, is that 1% too much? I know that patients out there use Google, but this worries me because it sounds so convincing that a
Yeah.
patient can not realize that it's incorrect. And I'm even more concerned about patients that are outside of the US where they can literally go to a pharmacy and say, hey, ChatGPT told me I have X syndrome. I need to take this drug and I'm here to pick up my drug. It's like, whoa, whoa, whoa. You didn't even see a
Yeah.
doctor. Your diagnosis might not even be correct.
But you're right. It's very different than the information that you get from Google, because with Google, you get a whole bunch of information and you've got to draw the conclusion yourself. Whereas from ChatGPT, it draws the conclusion. Like it gives you, this is here's a question, this is the answer, not just a bunch of information that you need to kind of coalesce and draw a conclusion yourself. So,
Yeah. And then to extrapolate, since we're having fun talking about the future, I'm more worried when the AI gets so advanced that not even the smartest human being knows if that thing is correct or not. And that's my bigger worry, because there won't be some human being saying, you know what, that's wrong. Like, we won't know.
or will we be enhanced humans by then, where it's a conglomeration, it's a combination rather of human and AI augmentation until ultimately we become more machine than man, to bring up Darth Vader as you did in the beginning and bring it full circle like a good stand-up comedian, call back to the beginning, more machine than man, to the point where we're not even human anymore and we're more convinced that we're human by the machine that now runs us.
No, and that's funny you say that. My business partner and I are constantly talking about that future. What will it look like? He and I have been following Neuralink and the patient that's been doing it. And we often have this conversation saying, you know, at some point it may be all the people with Neuralinks will have their own language because they'll be communicating at another level that us without the chips, we cannot. We won't know.
Telepathy.
Yeah.
I mean, you can't, like Bluetooth, Wi-Fi, the technology's there, like,
Yeah.
and the exchange of information can be rapid. And then someone can basically just upload your brain, like get into your head, because they can crack your password. They can hack into your brain. Great. This is turning into a nightmare, Harvey. We're supposed to be talking about how AI can make our lives, and you're turning this into another Black Mirror episode. Like we were talking about before, right? You had mentioned your digital twin, and I told you about the episode where, someone could upload their digital footprint. This woman, her husband died, so she uploaded her digital footprint to an app, or uploaded his, and then she was able to text with him as if he were still alive. And then she taught it his voice, so she was able to talk to him like he was still alive. I mean, there's like, why couldn't this happen now? This could, with all of my podcast episodes. Like, you've got 400. I mean, I tend to do somewhat more listening than talking, but still, there's so much of me out there. Like, someone could just program me.
Yeah. It wouldn't be hard. Let me
Right.
think about this. I think it was April. I was on Dr. Phil's TV morning show, and for fun, with permission of the news person, we cloned his voice, we cloned his image, we took footage from his studio, and then I asked him, "What do you want me to pretend for you to be saying?" He's like, "Well, let's pretend I'm introducing you and talking about deep fakes." And then the segment we put on him, and it's a deep fake, and it's him introducing me and explaining and all this, and then it wasn't even him; it was his face. We did lip syncing. We synchronized his voice. We did exactly, it's cloned his voice. And then we aired it. And then I came on and explained how we did.
So how do I know I'm really talking to you right now?
That's a good one. You're right. My business partner and I are actually working on a digital twin that can do these types of interviews in the future for me.
How far into the future?
I think we're about a year away from that, where it'd be convincing enough. That's what I think. Because I know I already cloned my voice. I have a podcast. It's called the GPT podcast. And I could
Mhm.
take any blog and I've already cloned my voice. And then I take that blog and then it's my business partner and I having a fake conversation back and forth, talking about an article, talking about some journal. And then it's all cloned. And we do it within 5 minutes. It's kind of
So you
crazy.
make a podcast episode of a conversation that never took
Never
place,
carried and never occurred. Correct.
and people want to hear that,
Yeah. Because we start off with, hey, this is a clone podcast. But we get lots of people listening to them. So it's
and they
interesting.
listen to it because they want to hear the content or they want to hear how well it works.
I think both. I think sometimes we try to catch things. For example, if Bill Gates comes out with a blog, within minutes, once we see it, we put it in, then we have a podcast about some blog that he wrote or some paper that he says, hey, this is the future. And then it's us talking about that paper or talking about the future, but it's AI really doing it. It's interesting.
To the physicians out there who are reluctant to start leveraging AI, what do you want them to know? What do you want to tell them?
For those physicians, I would say let's look at companies like NYU, Tron. They have this hospital system that what they're doing is putting predictive analytics of all the patients that they've had. And then if they have a patient that's similar, the AI says, hey, this particular patient needs to stay or this particular patient can go. And I think that's a good thing because, we have our clinical gestalt, but what if we had our clinical gestalt plus some data that said, look, this person, there's a 70% chance. And then you as a human can say, you know what, no, this is correct or no, this is wrong. But then at least you're getting better data. And I think
Yeah.
that's going to be huge.
Yeah. In the same way that I get alerts every so often that there's a drug interaction.
Yeah.
Like, yes, it helps me be a better doctor that I know that stuff. It'll help us. So is there anything about it, this technology, that scares you? Because you're embracing it, right? So what scares you about it?
Honestly, nothing really scares me personally, as long as I'm doing my best to just teach physicians and healthcare professionals because I feel like we have a background in medicine and we know when these things hallucinate or not. And then I'm teaching the younger doctors like, hey, do not rely on this. Don't become so dependent on this tool. My analogy is if I turn off the Wi-Fi for my kids, they freak out. So the same thing for
Yeah.
these physicians. They need to learn how to do it without AI, without any other tool.
Yeah.
Be a doctor. And so my favorite area for age-wise, I'm biased when I say this. I feel like the best physicians are probably the ones that are out 6+ years that have that experience of doing their specialty. And now they have this tool and now they can combine their years of experience plus this tool and say, you know what, this is the right middle. I'm personally more, when you ask for worries, actually, I do worry about the younger doctors coming up the ranks saying, this is absolute the gold standard when it's not. And so I'm really worried when I see that they're using it for their soap notes and not even checking or overbilling and leveraging to a point where I'm like, no, this is not medicine. This is not correct. And so just educating them to say, look, this thing, you got to be careful.
But I mean, it's the same in, we made mistakes when we were training. And then, those first couple of years out of training were also a big challenge and a big learning curve. And I'm confident in those that are coming after us, that they're going to have enough of an experience that they learn from those mistakes and it helps them to be better. So what gives you hope about AI, right? Looking into the future, you're seeing all these possibilities, some of them daunting, some of them intimidating. Is there anything about it that really gives you hope for the future?
Sure. I sincerely worry about our healthcare workforce. We don't have enough doctors, don't have enough nurses, or our population's only getting older. A lot of people are not happy anymore, so they're leaving the profession earlier. I sincerely believe that this gives us hope having a tool that can help prolong our work life. For example, I mentioned that nurse. If the nurse is starting to have back pain and cannot start lifting patients and says, you know what, I'm out, like I'm out. But if I introduce a robot to say, and I know that sounds kind of scary already, but if I introduce a robot, say, no, this robot's going to help bring the medicine, carry the patient, lift, help you get the patient out of bed, walk them to the bathroom, be able to do all those things. And that nurse says, you know what? Well, then hell, I can work another 10 years now. Burnout. If I have a physician that's just so burnt out from long EMRs that I can say, you know what? We now have it set where just your voice is putting everything into the EMR and it's giving you a differential diagnosis and it's catching I can put a risk management tool in there where it's saying, you know what, did you ask XYZ? And then I know it sounds kind of big brother-ish, but if the robot said, hey, doc, your differential diagnosis was X, and you're supposed to check the ears, and I never saw you check the ears, you probably need to check for XYZ to roll that out. And you're like, oh, crap, you know what? I hadn't even thought of that one. Yes, you're right. Just to have that. My example is even better than that. I'm an ER doctor. 4 a.m, I'm probably not at my best. But if I had a peripheral brain, call it a robot, call it an iPhone, that helps me maximize and get there because I'm human. I'm going to make mistakes. Then let's leverage AI. And so that gives me hope for a better healthcare. I'm personally working on a project through Help AI. And what we're doing is we're creating sensors and we're going to put them in people's homes. And I know, again, that sounds big brother-ish, but it's specifically for the elderly. And so,
Harvey, we've already let the sensors in our homes.
yeah. And so
they're on our Ring cams, they're on our cameras, they're on our phones, they're on our computers. We've let them in the front door. We don't have to worry about them sneaking in the back.
Yeah. And so what we're going to do is have this set up where if it's my mom or grandma, then these sensors can say, hey, Harvey, it's 8:10 and your mom always gets up at 7:30 and we haven't seen any movement. You may want to call her, make sure is everything okay. Or we noticed she didn't take her pills this morning and it's 5 hours late already. You might want to call and remind her to take her pills. She fell, she can't get to the phone, but then we have it set up where the sensor's like, hey, she's been down for 15 minutes. She has not gotten up. And now I'm able to know. So I see this as helping us. And then let's just say, God forbid, my mom now has to go to a nursing home or something. And then at that point, I could take those same sensors and put them in a nursing home. And then now I have an extra set of eyes saying, hey, my mom called for the doctor XYZ and she never got that. And so I'm able to help.
Sounds like a lot more alerts.
Yeah.
That's what you're going to get, a lot more notifications, whether you're the person working in the nursing home or whether it's your own family members. There's going to be a lot more pop-ups coming up, but hopefully for the better, make our lives better and safer.
Yeah.
All right. Well, if people want to learn more about you, hear more from you, listen to your digital twin podcast, where do we find you?
It's pretty simple. Go to HarveyCastroMD.com, and that's my website. And then that's the same for all my social media. It's just Harvey Castro MD. So I'm on all the major social media platforms. And then if you go to my website, you'll see my digital twin on the resources at the bottom right. It looks like a little eraser, and you can literally have a conversation with me about anything. All the same questions we just had. It'd be kind of fun to run it through the AI and see what it says.
Yeah, see what the difference is. Amazing. Well, Dr. Harvey Castro, thank you for all you do for your patients and for the profession.
Awesome. Thank you for having me. I appreciate it.
Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.